Welcome back to Open BxRx. Every day, hospital staff put their lives on the line to take care of others, and now more than ever through the COVID-19 pandemic. Today, we're speaking to a nurse who works at Lincoln Hospital here in the Bronx to learn about a day in her life in the wake of COVID-19. Thank you for joining us, Narelia Oliveras-Arzuaga.
Thanks. Nice to be here with you guys, Sonyi.
Thank you. How are you feeling? How are you doing? That's the first thing I like to ask up top.
Sheesh, that is a loaded question. I think I first want to say that I'm grateful because I'm okay. My family's okay. We're not lacking anything right now. We're not really concerned about how we're going to be after all of this. I think everyone's going to be okay, physically, financially. But I'm sad, I'm sad because a lot of people aren't going to be okay after this, mentally, physically. This virus just highlights a lot of the issues that we have in terms of how to handle something like this, in terms of how safe we really are. Like, public policy is in place that doesn't really prepare us for something like this. So this is unprecedented.
Right.
So mixed emotions, definitely.
And can you give us like a day in your life, what time you wake up for your shift and like how it is to get to the hospital? Do you drive there? Do you take the train? Describe your commute and like a day in your life as a nurse.
There's a whole lot that happens. My days are really long. I actually, I try to get up by like 5:30. So between 5:30 and 6, the latest, I'm up. I am fortunate that I'm able to drive to work, and from where I live to Lincoln, it's actually not that far. It's about a 20-minute drive. Lately, it's been like 10 minutes because there's been no traffic. With all this that's going on, there's been very few people in the street and few people commuting at that time of the morning. I actually start my shift technically at 7:30, and it's 7:30 to 8 p.m. So it's a 12-hour day, 12 and a half hour day.
Wow.
Yeah, we don't get paid for our lunch. So really they consider it like a 12-hour day, but you're really there longer because you try to get there earlier than 7:30. And you spend like half an hour getting report from the night nurse who gives you, like, they sign off to you, the patients. So usually we go around to the bedside, look at the patient together, discuss what's going on. Now in the wake of COVID-19, the doors to the rooms are closed to keep germs and whatever's in the air outside, like inside the room, the patient. So it's different. You have to gown up when you go inside the room. And so right now, as it is about half our unit, we have a 40-bed unit where I work, and we do step-down telemetry. So basically what that means is everyone is on a heart monitor because there's some either cardiac or respiratory issue that we want to monitor all the time. And step down is not ICU, but it's not a regular medicine floor. It's like an intermediate level of care. So we see some pretty sick patients on the regular, a lot of ventilators and things like that. Now with COVID-19, we're taking ICU cases. ICU is down the hall, and they are overwhelmed. We have 2 ICU departments. They have about 12 beds each, and they have been completely overwhelmed. Just about everyone in the ICU is vented and doing pretty poorly.
Wow.
So they have decided, they being hospital administration, has decided to give us ICU cases because we're the next unit that can handle ICU. So everything's kind of been changed. We have ICU doctors now and residents on the floor with us 24/7. They are working 12-hour shifts just like we are, where sometimes they would work like 8-hour shifts and they'd alternate between 8 and 12s. That doesn't really happen anymore. Everyone's there just like we are. So doctors are there 7 to 7. And then the night team also comes 7 to 7. So, but it's kind of nice that they're right there, that we don't have to like page or track them down. It's really like a lot of teamwork, collaboration, so, which is really important right now because no one can do this on their own. Doctors, nurses, respiratory therapists. Nobody can handle this madness on its own. It needs to really be like just teamwork 24/7. And the good thing is a lot of that has been going on lately.
My gosh, I can't even imagine, how it's going there, but thank you for describing it to us. Can I just ask you how long you've been a nurse and if you've ever dealt with something of this nature, of this severity at a hospital before?
So I actually have been in the field for, oh gosh, I think I started off as a nurse's aide actually many, many years ago. And so I did just a basic training for that. And then I worked in a nursing home. And then I became an LPN, which is like a step down from RN. But basically altogether, it's been about seven years now. That I've been in nursing. I've been a registered nurse for the last 3 years, and I just got my bachelor's degree this past December. So in the hospital, I've actually only been in the hospital about 8 months now. I was actually in a clinic before that, and I got a lot of experience there. But in the hospital, this is my first actual hospital job. So yeah.
Oh my gosh. So all of this is just like, ooh, it can get overwhelming, but you're all trained and you're all equipped in order to handle these type of situations. And fortunately, like you said, you're working in a team. So I'm glad to hear that you're all hanging in there together. Also, Narelia, can you just talk about the equipment and resources right now? Is there a lack at the hospital that you work in? Have you seen that, you're having a hard time keeping up with the equipment and the resources?
So definitely that's been a question on everyone's mind. That's definitely a priority because we can't do the work that you do if we, the health workers, get sick. Who's going to come in to take care of these patients? In order for us to protect ourselves, we need that PPE, that personal protective equipment. And so not for every disease is it as intense as it is for COVID. The issue with COVID is that we have different levels of isolation. You have to wear, basically that means you need to wear the mask. You have to cover your eyes. You should cover yourself basically from head to toe, like everything. So usually we just have to like wear gloves, maybe a mask or a gown when we enter the room. For COVID, you need to wear everything. So yes, we are gonna run out of PPE. It's been expected. New York has been hit the hardest state so far. So there's just no way to keep up the demand. I've read statements from different hospitals like Columbia Presbyterian that have said they've gone from using something like 4,000 to 40,000 masks a day. The numbers just mean that supplies are going to keep up with demand. There's no way we can do this. But thankfully at my hospital, we've been okay so far. We have not run out of anything. We get deliveries about 3 times a day of like carts that are loaded with everything. And we always have a charge nurse every shift that prepares like basically bundles for us. So we have everything we need in there, our hat, our gowns, our face shields, everything is kind of prepped for you. Which kind of helps because every single time you have to go into the room, you literally have to put on every single thing. So to be tracking down piece by piece would be really time consuming. And sometimes like there isn't time to track it down because your patient may not be doing well. You have to run into the room. It's happened to me already. Last Saturday, I had a patient that was basically his blood pressure was crashing and I had to run into the room. Thankfully, my bundle was there. I got dressed super fast and I went into the room to fix his medications. So we've been okay, but everyone's talking about how the lack of PPE is going to hit us eventually. So we're kind of bracing for that. Another issue that I found is that our tests are coming back super slow. So we keep putting on everything, going into these rooms, not knowing if the patient actually is COVID positive or not. So if tests came back faster, we would actually know, and that way we could not need to use so much PPE every single time. Right now, a lot of our patients are rule out COVID. Some of them are positive, but a majority of them are rule out. And the rule out, you have to treat it like it's a positive until you know otherwise. So we're using hundreds of equipment per shift. Yeah, it's just a lot.
Wow. And have you treated any patients with COVID at the moment? How does it feel to do that? And what is the process like behind treating patients with COVID-19?
Yes, I have treated patients with COVID. I've been treating patients with COVID for the last couple of weeks, I would say, which is when New York started to get really slammed, I think. Um, it really depends on the patient. I had a patient who was perfectly fine. All she needed was some oxygen that was being given to her and IV antibiotics, but she was alert, she was oriented, she was ambulatory, she could walk. So there, she was fine. It runs the gamut, basically, the spectrum. I've had another patient Saturday who was on 3 different medications for his blood pressure, heavily sedated, on a ventilator. Um, really, really not doing well. We took x-rays and his lungs 48 hours before I got him were completely different. But that's what COVID-19 does. That's what pneumonia caused by COVID-19 does. It wipes out your lungs. So you have very little lung function. So he was doing really poorly. He was actually an ICU case. So it really depends on what's going on. I think the better your patient is, the less you have to go into the room and expose yourself. All of that is obviously is a good thing. The sicker your patients are, the more they need from you. The more resources we're using, the more mentally exhausting and draining it is to care for them. So it depends. It depends on how your patient's doing. Majority of patients have not been so lucky to be ambulatory and all of that. We've gotten a lot of patients that have been, by the time they come to us, they're already vented.
Mm. And right now, Narelia, clearly, I'm gonna put this in air quotes. You're taking a break, right, from work, but you're honestly like thinking about this constantly. I can imagine, because it's so hard to be in your position and, and all these staff. So, we thank you from the bottom of our heart for doing this work continuously and throughout this COVID-19 pandemic. But right now, like in terms of shifts, like how are you? I know you described like the hours, but do you get a break throughout the week where you can get a 2-day rest or something like that? How are the nurses resting?
So we usually work 3 to 4 days a week. So which is kind of nice, because to do this all the time is exhausting. And I mean, before COVID, now it's almost like impossible to work more than 4 or 5 shifts a week. That would be so crazy. But yeah, so most of us have not been asked to work overtime yet. This thing hasn't peaked yet, like everyone's talking about. So it may come in the future, but usually we're on 1 or 2 days, sometimes 3, and then you'll have like a nice break after of like 3-4 days off. I just worked 2 days, and then I worked actually over the weekend, so Saturday, Sunday, was off Monday, and then went back Tuesday, Wednesday, and I'll be off until next Tuesday, which is kind of nice. I get like a 5-day break. The unfortunate thing is that you're stuck home. So, there's not really like many options for you to like kind of relieve the stress, so to say. But I try to turn off the news and not overwhelm myself, because like try to tell people like, don't send me a bunch of COVID information. I know all about COVID. Like, don't send me like news links or whatever. Like I'm living it. Like I know what it is.
Oh my God.
So that mental break is really important, to try to like step away. I'm home. I'm trying to like, relax, clean a little, just, give yourself that break.
De-stressing. And speaking of that, last question, if you can offer any advice to the Bronx community, what would you say at this time?
Definitely. I mean, there's a lot of advice to give, but listen to the authorities in the public health field, such as the CDC, government authorities. Don't listen to everything that you hear. There's a lot of misinformation still going on, unfortunately. Also, try not to freak out. Everyone does not have COVID-19. And just because you may have a symptom here or there doesn't mean that you should run to get tested. We're all overwhelmed. Hospitals are overwhelmed. Urgent care centers are overwhelmed. There's things to follow online. The CDC gives us really good kind of guidelines about whether you should get tested or not. So, follow that, kind of try to keep calm. Turn off the news every once in a while, try to make the best of being home in this bad situation. Maybe do a project that you haven't, had time to do before, or something like that. Try to generally stay healthy, eat healthy, maybe go outside and get some fresh air while while still maintaining social distancing. I think is perfectly fine. Our governor has said that's perfectly fine. And now the weather's getting nicer, I think that's going to be really good for people's, mental health.
Yeah.
So just basic things. And of course, hand hygiene is super important. If you can get a mask and you're going to be outside, because you have to go outside, you have to work, and you're going to be surrounded by people, try to get a mask. Um, try to be mindful of what you're touching. I've still seen people coughing into their hands, sneezing into their hands, like, so gathering without mask, without gloves. It's really disappointing, like especially for someone like me that's working so hard to fight this thing. And it's not just me, there's an entire community. All the medical professionals in the world basically are fighting against this virus that isn't even alive. So help us out, like seriously help us out by just, and yourselves out by just being smart. Think about what it is that you're doing, because all our actions right now, everyone's actions, have serious consequences.
Thank you so much, Narelia. Thanks for your time and thanks for joining us today. And thank you to all the hospital staff, from doctors to nurses, EMTs, even maintenance workers, for your dedication and tireless work in these hospitals. Open BxRx. We'll be right back.